Welcome to Precise. I'm Dr. Hans. Why live in pain? Why underperform in your daily life? We help you live a higher quality of life. This channel is dedicated to both educating you and showing you how we do that. Thank you for watching. Welcome, I'm Dr. Hans with the Spine Doc Show, and today we have Miss Tasha Lindsay. Would you like to introduce yourself?
Sure, I'm Tasha Lindsay. I'm a licensed professional counselor.
Excellent. Welcome.
Thank you.
So we're going to be talking about mental health while we're all quarantined with COVID-19. A lot of my patients have been asking me or communicating to me that they're just going stir crazy. What do we do? I see posts on social media. People just are getting a little bit bottled up. And if you're type A personality, you want to get out and do stuff. We all love our family, we all love our children, but if you're around them 24 hours a day, you do need your own time. So I thought I'd touch on this topic, and I know Miss Lindsay is well versed in this and she's an expert in this. I figured she'd be the perfect guest.
Thank you.
All right, so the first question that I want to propose here to ask is, what are reasonable daily and weekly steps that people can take to create space and create their own environment so they feel like they have, their own time, like me time during this quarantine?
I would say to continue to have something that you had in your normal routine that continues the normalcy that you had, that adds the comfort to it. But then I would also say create a whole new routine, like get creative with it. Allow yourself to say, even though I'm home with my family now and we're teleworking, during these hours I'm doing a walk, or I'm doing a workout, or I'm going to make some herbal tea or something like that. I think
Consistency.
Yeah, it's like create a new routine, but also add some consistency in there. Make sure boundaries in there.
So don't let your daily structure just go to waste and do whatever you feel like.
Exactly, because I found myself doing that. The first week it was like, all right, let's try to just go to the office in my house and see if I can just sit in there from these hours to these hours. It wasn't working. It starts to drive you crazy. Then I'm like, all right, let me take more breaks. You have to keep trying something until you get to a place where, all right, this new norm works for me.
Okay.
I even think we should do something new, like to get you out of bed, because you don't have to drive anywhere now.
Right.
So if you just get yourself out of the bed with a hot shower, or now you can take a hot bath because it's relaxing to start your day off, but you also don't have to rush and go and get in the car. Morning sex, exercise, anything that can get you up and out of the bed and get you excited to start your day.
I've heard a lot of my patients say that, I just go to work in my pajamas. And I personally didn't think that was a good idea, but you're shaking your head right away now.
No, because I tried it. I tried it, but it doesn't feel good. I feel like when I got up, and it's like when I really do a routine, you get in a shower, you moisturize, you put your fragrance on that makes you feel good. You actually put something, even if it's a nice shirt and some comfortable pants, something that makes you feel good. Because pajamas, you mentally associate that with getting into bed or going to relax. You're not going to be mentally ready to go to work when you do that. So
yeah, it gives you a purpose every day. So you're in a frame of mind that I'm going to go do work. I have a purpose, and you're structured to get it done.
And have a to-do list.
Right.
I'm big on to-do lists. So with to-do lists, I'm pretty much, you already know, like, I'm not going to do, for me, from 9 to 10 I'm doing this.
Yeah.
That doesn't work for me. It's too tight. But throughout the day, I need to hit these things. And then you feel like, as you check them off, they make you feel like you're accomplishing something.
Purpose. Every day, it sounds like that's what I'm hearing. Purpose and structure and goals, and not allowing yourself to feel like you're home even though you are home. Give yourself a larger, higher purpose of, I'm going to work. We got some patients leaving here. We're still at the office right now. So, have a good day, you guys.
You too.
See ya.
Bye.
So, you've been hitting a lot of my questions right up front. This is good. This is going to open up a whole free flow conversation, is what we want here.
Sure.
So the second question that I had for you, if someone feels, I believe people with anxiety, or just maybe that people are used to getting out a lot, type A personalities, might feel trapped or have a small anxiety attack or even a large anxiety attack, how do you manage that immediately in that moment to calm down? And then what are some long-term steps we can take to help prevent that?
Immediately, I would say get moving. Because if you sit there and you start mulling over whatever it is that's causing you to be anxious, it's going to just add energy to that. Where if you get moving, just already having your mind, if you know you're an anxious person, just drop down and do some push-ups. Or obviously now you can't go outside and go for a run, but sometimes pacing helps some people because then they can process whatever they're doing if they have the space to pace in their homes. Some deep breathing. Sometimes if you just stop, sit down, and do some deep breathing, that shifts your energy and it slows down your heart rate and your blood pressure.
Okay. Do you recommend like a mantra you could say to yourself, some kind of like a one line or a small 3 or 4 line?
Yeah, I would prefer to say something like, I am relaxed or I am calm.
Okay. Because
it shifts your mind away from the anxiety.
Okay. Do you suggest maybe we tell the people we live with that if I feel like I'm getting a little bit anxious, this is how they should interact with us? Maybe either give me space or hang out close, whatever you prefer?
Certainly, because I think that's another form of creating those boundaries. Because now it's like everyone is in the house at once. You're used to just seeing them after work or before work and vacation time or something like that. Whereas now you're seeing them all day. So even the kids will have to create reading time, play time. They have their boundaries too.
That's a great subject you just hit on. Boundaries for the kids. I'm hearing 2 schools of thought, and again, I keep referencing my patients because that's my social circle right now. It's my patients. But patients talk to me, so I'm hearing that some kids are structured as if trying to replicate school, and some kids are just sort of free flow. It's probably tough to know what works best for every kid, but what would you say, where do you begin with if things are out of control? Where would you begin with that subject?
I think kids definitely need a routine. Otherwise it would drive you nuts. Just because I think a healthy balance of both. So obviously they need, I would say, loose structure. Because they have to do the Zoom online with their schools. But I think they need to have free play. But it should be set times of free play. And then even outside of the school lessons, they need to have some reading time, some drawing time, so they can have arts and crafts, and they created something at the end of the day. And then they also had, I got to do this yesterday, They can relax and you can go relax at the same time.
How do you think that kids remaining in contact via Zoom or phone calls or Skype or with their friends they would usually hang out with, is that important? And it seems like an obvious question, but
I think they should still check in. Most kids now, they have tablets or their own phones, FaceTime with their friends, because they can't really go outside unless they live across the street. You can wait.
most kids are more technologically adept, and they're probably thinking my kid already does that.
They have phones.
Yeah.
My 6-year-old niece has a phone. They use it.
So keep that going.
Yeah.
Okay.
In moderation.
In moderation. Health is moderation on every level.
Yes.
You've said this was a question that you've touched on it so many times that I think we already know what the answer is, but the importance of maintaining a routine in your life and your family's life and the environment around you.
I think
about that?
Having a routine right now is literally the only thing that's going to keep you sane, because otherwise you're just going to focus on what's going on and what you don't have access to. But if you create a new routine that you enjoy, I think there are always these things that if we're at work, we're like, I wish I had time to work out more. I wish I had time to do X, Y, Z, but then you're confined to the weekend. Well, now you're in the house all day, so you can fold those clothes and, obviously do it on your breaks, because you still have to get your work done. I'm not going to promote, you're at telework, you got free time to do all your house organization skills and all that, but I think that
we don't have that commute anymore.
Yeah, you don't have to commute, so that's at least 2 hours right there. That is for me. That adds on to the day, but it's just you can do all of these other things if you actually put it down on a schedule and commit to it. It's more purposeful that way.
Right.
Otherwise, I'll say, I'm going to do this, and a whole nother week went by, I didn't do it.
That's funny you say that, because that is human nature. We'll do it next time. Well, next time is next weekend, but weekends are busy, so we don't do it that year even sometimes. Yeah,
and I think it's it's a good time to really learn yourself now. Because it's like you have no distractions. You don't have any access to a lot of the distractions that we ran outside before, to the restaurants or to the park and all these places. And so now it's like, what can I do now that is productive but also equally fulfilling for me and healing? Like, it's so many things you can be in the house doing. You can meditate, which is hard. It's hard to focus and clear your head. So now you can say, all right, I can learn how to meditate by adding on minutes to it each day or minutes to it each week, because I can focus on it now. You have prayer time. You can create new meals that you wanted to cook that normally take too long in the evenings, but you're home now.
Right.
You can prep it and
perfect that.
Yeah, it's so many things I think people can do instead of focusing on, all right, I can't do this, I can't go here, I'm upset. No, but what are the things that you can do?
You can reinvent yourself.
Exactly.
And I think what you're touching on is you can control the controllable, what is within your ability to affect.
Yep. And those indoors, it's tons of things we can do indoors. Dust. You can declutter your house and you won't like feel the same after. It'll feel like you cleared your mind, you cleared your head, because your space is a reflection of how you feel on the inside.
Interesting. This is great. This is a great topic. I like it. This is why I have Miss Lindsay on.
Thank you.
So, create boundaries, have a routine, prepare yourself every morning as if you are going to work, no pajamas. Keep your kids on a loose, structured routine, and take the time to reinvent yourself.
And turn off the news.
Turn off the news.
Turn it off.
But turn on your Facebook Live.
Social.
What are your, actually, I have a patient brought this up today, and this is a tough subject because it has to do with employment. So before we get into it, you gotta understand your employer has the final say. We're not advocating that you do things to get on their bad side, but some their employers have expectations that they should be available now, basically all the time. I don't mean 1 in the morning, but they should be available 8 at night, 9 at night, for clients within that business to reach out to them, whereas before they were at a desk and they were available 9 to 5 or 8 to 4, you get the gist. How do we maintain these boundaries on a reasonable level so that they're both maintaining favor with their employer, but also not letting it run ragged through their personal life? What are some tips you can have to start to address that?
I think just as we have personal boundaries, there are professional boundaries. If I'm in an office and someone walks up and we're busy in the middle of something, we get to say, can you come back for a moment, or can you give me 15 minutes? If we're home now, obviously you have the mobile devices. They want you to be available, like you say, 24/7 maybe. But after a certain time, for some people, religious reasons, after a certain time they may pray or whatever the case may be. So after 8, can you give me 12 to 24 hours to respond, or I'll respond to this by 9 o'clock in the morning. But you start to set that new tone, and then that way they can't expect anything that you didn't present. Don't respond.
Right.
But it doesn't mean you're not going to respond as in I'm not doing the work, but I'm not going to respond between these hours and these hours because these are my sleep times.
It's when you said that, I remembered you can have an auto reply on your email. For example, if you get an email after 8 p.m. like you mentioned, or 7 p.m. when sitting down to have a meal with your family, don't let that get interrupted. That's important time. But you can have an auto reply that says, thank you for your email, thank you for your question, I'll be available, I will respond within the next 24 hours. Hope you have a great night, or something like that. Something courteous.
And you just made me think of the family time. Like, don't assume just because you're at home it's quality time. If you're in your office, you're not doing quality time with your family. Right. So you need to have committed time to your family, just to have committed time to your telework.
Right. So invest 100% in whichever one you're doing.
Be present.
Invest in work, invest in your family. Don't try to mix it up.
Yep.
Great. These are great tips. You can use this beyond. You can use all this beyond COVID-19, by the way. This is gold right here. Okay. I hear people talk a lot about work-life balance, and and to share a little bit about my story, like starting my own practice, it was all work, very little life. That's changed, but work-life balance is important. So I've found that out recently. Miss Lindsay, I've actually talked to Miss Lindsay about it a few times. She knows what's going on. This is all great stuff, and it's a chance to reinvent yourself right now.
Absolutely.
Yeah, yeah. How are you going to come out of this? Are you going to come out of this prospering and doing well? Because challenges are a chance for us to really test ourselves.
Absolutely.
And no one's perfect. We have to understand what didn't work, and we can change that to what works better. Anything that you've thought of that you want to touch on while we've been talking?
I don't think I have anything else to add.
Yeah? Okay. That was good. Let me look at some of these questions coming across here. How you doing, Miss Reed? Dr. Kemp, how you doing? What's the importance of getting outside to you? Now I know we're not supposed to go out and mix with people, but just you have a deck, you have a patio, you have a backyard, you have a front yard. Let's say you have a small loop in your neighborhood that you maintain that social distancing. What is the value of fresh air, sunlight, out of the confines of your four walls?
I think we definitely still need that vitamin D. I've only went out a few times, but I noticed the difference in how I feel even from driving out today. Just taking a ride, no one's in the car with me, so obviously it's built in social distancing. But sometimes walking around the community, even when I was driving around to leave out of the community, I saw people walking and just seeing people out again. It wasn't any people, but it's still nice to be able to go out there, or sometimes I'll go out on the deck, just get that sunlight on your skin, the breath of fresh air.
And do you calling our friends, calling family members, even talking to, it sounds funny, but coworkers maybe you had a good relationship with, just maintaining contact with them and saying hi for no other reason. How you doing today? I think there's a lot of value there.
It definitely is. I still, like people I sat near at work, we'll do a group chat and we pretend like I'll say the same things that I said when I walked in the office in the morning. Like I speak to everyone individually by their name, but it's like a way that I say their name. So we continue to do that, and so it adds to normalcy. So it gives you that comfort to make you feel like, oh, this is still a part of my new routine, my routine, but it's still like, it's new, but it's old.
Right.
Help people in.
I like it. Well, I think that we kind of touched on a lot of stuff, didn't we?
We did.
Yeah. There's a lot more information and knowledge to tap into here, Miss Lindsay. We're gonna have her back if she wants to, hopefully.
Sure.
We'll talk about other things like, trauma after concussion, trauma after car accidents, how to best overcome that. I hope you gained a lot of knowledge from this and insight. A lot of it is stuff that we might know, but we need to be reminded of, or stuff that we didn't really think about. But we'll all get through this together. Community is important. No one does it alone. Reach out to friends that you've been thinking about, and if you think they're doing fine, call them, say hi to your mom, your dad, your grandparents, your sister, your brother, your friends, your neighbor. Always wave, always say hi, and remember, community is what supports us. So thanks.
Check in.
Exactly. Check in. All right, thank you for watching. Have a great day, and we'll see you later.
See you.